Okay, so you can see here mold, mycotoxins, and a dysregulated immune system. It's important to mention that mycotoxins are systemically bioavailable irrespective of the route of exposure. So if these guys come through your lungs, they can get anywhere. They don't stay in the lungs. It's not, mycotoxins aren't like Vegas. You know what happens in Vegas is supposed to stay there. Mycotoxins can go everywhere, systemically bioavailable irrespective of the route of exposure. Mycotoxin exposure via the airways results in systemic bioavailability in animal models. Multiple organs are therefore potentially exposed. Even oral mycotoxin intake resulted in chronic inflammation of the lungs. So when it comes in, it doesn't matter the route of excretion, it's going systemic, and you're going to end up with a systemic problem. That's why it's such a hydra. That's why it can manifest as so many different types of illnesses. As I said earlier, one of the largest health threats in the US, mold exposure is a great mimicker of disease and responsible for misdiagnosis and mismanagement in medical treatment. That's really, this right here is really the kicker. Because how many of you have ever been to a doctor and you had joint pain and they gave you a steroid injection, or they gave you a non-steroidal anti-inflammatory, or they gave you an opiate pain suppressor, right? Or they sent you to pain management, of all things. You know, the crazy thing about pain management is pain management drugs shut down your kidney and liver function. And they erode away your gastric lining inside your GI tract. And so now you have leaky gut and you have dysfunctional kidneys and dysfunctional liver. How are you going to combat mycotoxins when your detoxification organs are being hammered by medications designed to mask the symptoms that the mycotoxins are causing? So it's the mismanagement and the misdiagnosis of mold-related illness. So that's why I want you guys to have a copy of this list, because these are some of the most common things that we see. Skin elasticity change. What does that mean? Well, what happens, as I said before, mycotoxins cause accelerated aging because mycotoxins are reactive oxygen species. What that means is they're free radicals. Many researchers have found that mycotoxins look almost identical in some ways to the exposure to mycotoxins looks like radiation poisoning. What is radiation poisoning? How does it hurt people? Yeah, it destroys their genetics. And when your genes are being destroyed, when your DNA is being damaged, what's one of the things that's going to go first is your collagen. And so your collagen will be breaking down in your skin. And so you'll get elasticity changes in the skin. But remember what else is made out of collagen? Your blood vessels are made out of collagen. Your bone has a collagen backbone to it. So collagen is a pretty important tissue. Heart palpitations. And this has to do, the heart is the largest nervous system, or the third largest nervous system in the body. So you have your brain and central nervous system, you have your enteric nervous system, your GI tract, and then you have your heart. Your heart has a giant bundle of nerves that run right through the middle of it. And remember, mold toxins are neurological toxins. It's part of how they do damage, is they damage nervous tissue. Low libido, chronic fatigue. I think it was a doctor in Dallas who had a ME/CFS, chronic fatigue syndrome practice. When he started looking at mold toxins as a potential for what was driving chronic fatigue syndrome, he found in his practice about 93% of the patients with chronic fatigue syndrome had mold toxin poisoning, had elevated mold toxins. Vision loss, eye irritation. So the eye irritation is an allergy response. The vision loss is a neurotoxic response. Sinus congestion. Remember what I said earlier, when mold starts to wear away at your immune system, it can start to colonize your body. It loves to colonize the sinus cavities. And this is why a lot of people develop sleep apnea. How many people are on CPAP machines for sinus congestion, right? So there was a study published in JAMA, Journal of American Medical Association, it was probably 20 years ago, showed in the Houston area, in the greater Houston area, the vast majority of upper respiratory sinus infections were actually not bacterial in nature, they were mold. So when you take an antibiotic, by the way, what is an antibiotic? What's penicillin? No, it's not mold. It's mycotoxin. Penicillium is the mold that penicillin is derived from, and many other antibiotics. So when you're taking those drugs, you're taking mycotoxins, and what do mycotoxins do to other life forms? So it's called an antibiotic. Biotic, life, anti-life. Now, I'm not saying that don't take an antibiotic if you need it, if it can save your life, if you have an infection that needs to be treated. But what I am saying is there's this practice in medicine today of just-in-case antibiotics. Oh, you got a heart problem and you're going to get a dental cleaning? You have a mitral valve prolapse? Here, take the antibiotic before you're cleaning. It's nonsense. Oh, you have an upper respiratory infection? We're not sure what kind of infection it is because we're too lazy to culture you, but we're going to give you an antibiotic. So imagine now you're knocking out your bacterial flora. What is one of our greatest protections against mold poisoning? Our healthy bacteria. What is mold's, in nature, what is mold's kind of seesaw buddy, if you will? You ever get in a seesaw when you were a kid and you're back and forth, and if you had a fat kid on one end and a thin kid on the other, it was miserable for the thin kid? Well, that's mold and bacteria. They kind of bounce back and forth. They keep each other in check. So when you knock out your flora with antibiotics and you don't get confirmation that you need the antibiotic, what does that mean? That means you're making the mold potentially stronger. And if it is a sinus congestion infection of mold in your sinuses, you're making it stronger.
Are all antibiotics molds?
Not all, but a good chunk of them are. Autoimmune development. This is what we see in my practice. I get every kind of autoimmunity you can imagine. This is autoimmune disease. People are told that autoimmune disease is your immune system being too aggressive and attacking you. And what in reality is not happening, your immune system is not attacking you. Your immune system is appropriately behaving against environmental responses. So with autoimmunity, there are triggers. The biggest triggers for autoimmunity, mold is one of them, but there's 4 categorical triggers for autoimmune disease: food, chemical exposure, microbial imbalances, which would be like bacteria or mold or parasitic, and then nutritional deficit. Nutrients regulate the immune system's reaction. The first 3 things, the chemicals, the food, and the microbes are stimuli from the environment. If your immune system is being overwhelmed by the wrong environment, it is not attacking you. It is attacking the environment. And in the process, it's doing collateral damage to your tissue. So when you suppress your immune system with biologic medications or steroids, which is the common treatment for autoimmune disease, and you don't adjust for your environment, you're not going to win. You're going to get cancer. That's the guarantee in autoimmune treatment today. You want cancer? Go to the rheumatologist and let him put you on a biologic for the next 20 years of your life, and you'll get cancer. Because you can't suppress the immune system. The immune system isn't wrong. The immune system is appropriately behaving to your bad environmental exposures. So figure out what your bad environmental exposures are, and you'll win. I mentioned earlier fever of unknown origin. This is a big one here too, night sweats. And we see this a lot in women who think they're going through menopause. See it a lot. We see what I call pseudomenopause, which is when somebody's in mold and they're in their 40s and they really shouldn't be going through menopause, but their body's behaving with symptoms of menopause, and they think they're going through menopause. And mold is a hormone disruptor as well. There's one particular type of mold toxin called Zea or zearalenone, which is a estrogen mimicking mycotoxin, and so it binds to estrogen receptors, and it can create all kinds of nefarious problems. When I was in mold, my Zea levels were super high, and one of the things that was happening to me is I was developing kind of a weepy attitude about everything. Like I'd just be driving in my car and I'd just start bawling, just start crying. It's like, am I turning into a woman? What's happening? No offense, women, but guys usually don't do that kind of thing. And then I was developing cherry angiomas, and that's another another one that you should keep an eye on, because the estrogen mimicking effect of Fusarium mold toxins will cause an aggressive growth of cherry angiomas on the skin. These are these little red, they look like little red freckles, but they're really bright red. So if you've started seeing those pop up all over your skin, either suspect that you're being overexposed to xenoestrogens from plastics or phthalate chemicals and things of that nature, or suspect mold.